Hi everyone, welcome back to Nurse Katherine here. Welcome back to another skill set video for nurses. In this video, I am going to be teaching you how to teach your diabetic patients how to check their blood sugar. This is also a teaching for you as a nurse, as a bedside nurse, how to check a blood sugar level, or also known as a blood glucose level. We are going to make this video short and sweet, so let's get started. I have seen nurses in the past check blood sugars wrong, and the results can be skewed because of the wrong technique in checking a blood sugar. So make sure you pay close attention to everything that you need and pay close attention to the actual steps when checking a blood sugar in this video. Before you get started with your teaching, or before you get started with going to check a patient's blood sugar, make sure you have all the supplies you need. So you will need your blood glucose testing, the strips that go with that specific monitor. You will also need a cotton swab. You will need an alcohol prep pad or any kind of alcohol pad. And you also need your needle or your lancet, however you are going to be poking the patient's finger, or even maybe if this is your own finger, how you will poke your finger to get that blood. A lot of you might ask, why do you need an alcohol swab and a cotton ball? Well, you need the alcohol swab to swab the finger first. That is the biggest mistake most people make when checking a blood sugar. I know from ER experience, when we were in these really bad situations, we would not always wipe the finger off before, and that can skew the results. So make sure you are doing it the correct way. So I am going to tell you the steps really quick, and then I'm actually going to show you how to check the blood sugar, and I'm going to check my own blood sugar. First step, of course, is making sure you have all your supplies. Second step is wiping the finger with an alcohol prep pad. Third step is getting your meter ready to get the blood. Not all meters are quite the same, so make sure you follow the directions that come with the meter. Then you are going to poke the finger. After you poke the finger, this is another huge step that a lot of people miss that is so important for accurate results. And that is wiping away the first drop of blood. That first drop of blood is not the most accurate drop of blood, because if you try to get that, there still might be a little bit of alcohol residue in that drop of blood, and that will skew the results. So make sure you wipe away that first drop of blood, then use the second drop of blood to check the blood sugar with. Then lastly, get that blood on the strip and wait for your result. All right, so here we go. Let me check my blood sugar for you guys so you can see the proper steps and how to do this. Like I said, step one is wiping the finger. I'm going to use my middle finger on my non-dominant hand because it's just easier for me to do right now. So I cleansed my finger off. Next, I am going to put my strip in my meter. An important fact for anyone out there is just don't keep your meter strip top open. The light and the air can actually damage these, so make sure you keep this closed at all times. That's why they come in containers that are black and not see-through. This meter has me put the testing strip in first, so I'm going to put that in. That is in the whole way. Now you can see it is asking for the drop of blood. All right, I'm going to use the side of the finger because this is the most calloused part of the finger. So you always want to use a bit of the side of the finger when you're getting that drop of blood. So 1, 2, 3. I don't know if I poked myself strong enough. All right, I'm getting some blood. It's not always the best idea to squeeze the finger, but in this case, I just didn't poke myself deep enough. Wipe away that first set of blood, that first drop. And you might have this problem with some patients. You can tilt their hand a little bit because you do need a good amount of blood for these testing strips. You don't have to poke somebody twice. I think that might be enough there. So next, you don't put it on top, you actually do it from the side, and you get your blood there. All right, then have the patient squeeze their finger, get that blood. And my blood sugar is 95. I just ate breakfast, so that makes sense. And guys, that is how you check a blood sugar. As you can see, my result is 95. I just ate. That is within normal limits. As a reminder, a normal blood sugar for a healthy individual without diabetes is between 70 and 100. Another important fact to teach your patients is always change where you're taking your blood sugar and always change where you are giving yourself insulin. You can develop these, we'll say, pads underneath your skin that will not absorb insulin as accurately anymore because of the scar tissue, so you can call them scar tissue pads, and they don't allow that insulin to absorb well anymore. So these patients who are always injecting themselves in the same spots and not sure why their sugars are not under control, that may be a big reason why their sugar is not under control. All right, that is it for this video. Thank you for watching. If that was helpful, give this video a big thumbs up. Do not forget to subscribe to my channel. And if there are any other skills in nursing that you want me to review with you, just comment below. All right, have a great day, everyone, and I'll see you in the next video.